Alrighty, guys. Thank you for tuning in to another episode of Paid and Passion, where we let our passions work for us.
Yeah, sir.
Today we got one of my best friends on here, man. Mr. Larry, could you explain to us and share with us the passion that is paying you right now?
For sure, for sure. Like Josh said, my name is Larry Haygood. Currently I'm a board certified behavior analyst. So I really have a passion for helping individuals and being able to advocate for yourself. I feel like that's one of the largest things. It's really important for me is self-advocation. So I got into this field straight right before graduating undergrad at UGA with Joshua, go dogs, go dogs.
Go dogs.
But yeah, so I work with kiddos with autism or who are on the spectrum and have other developmental disabilities, help them to gain the skills that they need to be functioning members of society, be able to have independent daily living skills and, just be able to go out into the world and do the things that they need to do without extra supports. Um,
Definitely, definitely. So I hear that train coming by.
oh, yeah, my
Uh,
bad. Yeah, for
no,
sure.
you good. Yeah, you're good. So what got you into working with autistic kids, like specifically?
Yeah. So I was originally majoring in landscape architecture at UGA. It was one night, it was really late, and I was like, man, this is like, I don't think this is for me. Like, just the consistent late nights, working on a lot of these really tedious projects. And I was like, I don't think this is for me. But I was always interested in sociology, which was my minor at the time. I was like, okay, this is kind of cool. Let me look into psychology. So I ended up changing my major to psych, and really just learning about a lot of different ways that the brain works. That was very interesting for me. And I have a cousin who's on the spectrum. He's now 23. And unfortunately, he didn't get a lot of the help that he needed
Mm,
very early on. And so, like right now, he's not, functioning on his appropriate age level at that 23-year-old age level that he should be functioning at.
right.
So, it was just something I was interested in. I was really doing research on like what type of careers I could get into with psychology. There's not a whole lot that you can do with just like a bachelor's degree, but I was really looking into what I can do. And not far from the UGA campus was a Hope Bridge autism therapy center. I went in, I interviewed, took a look around. I was like, wow, I really love this. Working with the kids was really rewarding, really fun. It looked to be something that I could do long term. And after being there for a while, I'm like, yeah, this
Okay.
is this
Okay.
is definitely where I
Yeah.
want to be. Yeah.
Yeah. I definitely want to highlight your landscape architecture days. And I think that's a great example. So I just came from an event, a high school event today. Basically like just sharing with students like there's a pressure to really know what you want to commit your life to at the before you're 18. And with the lack of exposure and experience, I just don't think you're gonna make a very accurate decision, which you could,
Yeah.
you can, but most people are not gonna make an accurate decision on where they want their life to go based off of again the lack of exposure, the lack of experience, the lack of knowledge.
Yeah.
So like you really used to be outside like in the woods. I'm
Yeah.
like
That-
I'm like, bro, Larry, where are you at right now? It is 10 p.m. and you like in the middle of the woods,
yeah. I
real
actually had
doing
classes.
work. Like,
Yeah. Identifying different plants out in the woods, like surveying landscapes, like all of that. Like, yeah, this was like a full-time job, literally
yeah.
almost.
What made you want to do that before? So I'm just trying to get as far as like the journey of whatever the
Um,
reason that you were interested in that and what kind of I mean, it is a different it is in a whole different industry, a whole different type of
very, very different.
education that you got to go to
Yep.
school for and who you working with and lifestyle. So what made you do that first? Start out as that and then transition over, excuse me.
Um, Being completely honest, it was my dad, really. So my
Mm,
dad, he's in property management, but like he had like a large interest in architecture, and in drawing. And I was a
mm,
fairly decent like artist. Fairly detail oriented, and like I said, it was just something that my dad really pushed. And I was like, you know what, like yeah, I think this would be like a really cool career. I think I'm gonna get into it. And
mm,
in applying for schools, I got into a couple different schools: Auburn, Kennesaw, Georgia. It's a couple different schools, and Georgia was one of the ones that gave me like an actual full ride. And I'm like, okay, what do y'all
Mhm.
have like that's similar to? And it was landscape architecture. So I was like,
Mhm.
okay, let me look into it. And going to talk to a lot of the professors that were down there, some of the people that I
Mhm.
knew at UGA already that were in the field. I'm like, okay, yeah, this does seem interesting.
Mhm.
So that's really what got me into it. Like I said, it was just like I realized that it was not for me, and
Mhm.
this was the end of my sophomore year. So going into my
Okay.
junior year, when I'm like, yeah, I'm gonna have to change my major.
Yeah.
It was very fortunate that I did do dual enrollment
Okay.
in high school, so that I was able to have like some of those credits to pad. Because, like you said, it's a very large tangent. It's very
Right.
different fields, and the courses that you had to take, the background knowledge that you had to have, et cetera, et cetera. It's very different for sure. Um, but yeah, it was starting with my dad because, like I said, it was something that he was really interested in, and he like pushed on me. I was like, I feel like he'll be good at this, and so I was like, yeah, I
Mhm.
think so too. But yeah, when I found this, I'm like, yeah, this is definitely the place for
Right.
me.
Right. Okay. So once you realized, you pursued psychology, you went to the Hope Foundation. It was in Athens, or was this like somewhere else? I
Um,
don't. You didn't say Hope Foundation, but I kind
It's
of like
Hope
summarized.
Bridge. Hope
Hope
Bridge.
Bridge.
Yeah,
Okay.
yeah, yeah. They're an autism therapy center, so they provide one-to-one services, and
Mm-hmm.
so it's ABA is the actual science, which
ABA.
is applied behavioral analysis.
Okay.
Essentially, we are making change in behavior um, to make long-lasting change.
Mm-hmm.
So we are focused on everyday skills from things as simple as communicating, like asking for your wants and needs, being able to identify different things in the environment,
Mm-hmm.
um, imitating different things that you do see, because that is a
Mm-hmm.
large way of the way that we learn as humans.
Mm-hmm.
And as living creatures, just we learn by seeing what others do and imitating that. Being able to function socially, having good social skills, being able to greet others, return greetings, hold conversations, all these different things that we need to be functioning members of society, as it applies to behavior, are the things that we do directly work on.
Right. So were you ready? Were you getting this experience while you were in school also?
Yeah, I think it
Okay.
was maybe a quarter or maybe halfway through my senior year,
Mm-hmm.
when I was really like, okay, what am I going to do with this degree
Mm-hmm.
when I finish? And after looking around, was when I found that Hope Bridge. And I think
Okay.
I started, yeah, about like halfway through the year, started working with them. I worked with them through the end of the year, before moving out here to the DMV area, moving to DC, worked at another clinic here. And at every clinic I was at, whether I really enjoyed the clinic itself or enjoyed the people, I knew like I really enjoy this field. Like I really
Mm-hmm.
enjoy what I do on a day-to-day basis.
Mm-hmm.
Um, at that point, I was a RBT, or a registered behavioral technician,
Okay.
and that is where I'm providing the direct services with the client one to one.
Mm-hmm.
Um, Having a session with them that may last anywhere between an hour to 4 hours in a day, where
Mm-hmm.
I'm working on those skills one to one.
Mm-hmm.
And the position that I am in now as a BCBA, I am really writing the programming for these kiddos, making the programs that the therapists are going to work on with them, making what we call BIPs, or behavior intervention plans.
Okay.
So if a kid like engages in, I don't know, aggression, we operationally define that. So basically, that means we're writing exactly what that looks like. The
Mm-hmm.
big thing around ABA is that we're very data driven. So
Mm-hmm.
everything is based in numbers and data. We want everything that we're looking at to be objective, observable, and measurable. That's one of the big things that we're looking for, that insurance is looking for us to continue with a lot of this work. Um, so yeah, that was like the big thing there for sure.
Mm-hmm. Could you give us an example of like what those measurables would be? Like, would that be like number of tantrums within a number in a set time? How many times did this student lose focus or get up or outburst or something like that?
Exactly. Yes, that's exactly
Okay.
what it is. So
Okay.
for example, like with the outburst, we'll say, in addition to maybe how many times they did it, we may look at, for every behavior, we're going to look at it in a different capacity, whether it's going to be a rate or how many times it's done over. a certain period of time. It may be a duration. So how long are these
Mhm.
tantrums lasting? How long are these outbursts lasting?
Mhm.
Um, it may be simply just a frequency, just how many times it happened overall.
Mhm.
Um, but yeah, making sure that it's measurable. And from there, we make sure that we define like exactly what that looks like. Because I can say a tantrum, we're supposed to be recording any tantrum that this kid has,
Mhm.
but a tantrum is going to look different for this kid versus this kid versus this kid.
Right.
And so it's going to be what we call operationally defined. For Johnny, this tantrum is going to be that he is engaging in two or more behaviors that may include hitting, vocal protest by saying no, I don't want to do that, or something to that effect. It may be kicking, it may be swiping things off table, but whatever behaviors we may see within that, what we are defining as tantrum, all of that is going to be operationally defined, clearly written for our therapist to know exactly what it is that they're measuring.
Mhm.
Um, we will say that this is onset, or it may start by, or we know to start that timer when this has happened, when it's a combination of two behaviors, and we know that it's over when they are behavior free for maybe 10 seconds for a kiddo. It
Okay.
may be
Mhm.
2 minutes for another kiddo.
Okay.
So
Okay.
there needs to be like a clear onset, there needs to be a clear offset, and there needs to be very clear criteria for exactly what that behavior is going to be.
Right. Okay.
Same thing for like if we are targeting any specific behavior, like for example, responding to greetings. Um,
Okay.
our kiddo, we have a plethora of different kiddos, and every treatment plan that we write for a kiddo is going to be individualized exactly for that kid. It's not going to be
Mhm.
anything that's cookie cutter that works for everybody.
Right.
Of course, the science is overarching for everyone, but it is applied individually for each kid.
Mhm.
So, for example, as far as communication, we may want our kiddos to respond to greetings, which is something that we want for anyone to be able to respond
Mhm.
to greetings. That may look completely different from a kid who's verbal or is who is talking, as opposed to a kiddo who uses a AAC device, or a device where he may click buttons that will speak for him, or a kiddo who is working with something that we may call PEX, which is a picture exchange communication system, where he's picking up pictures off of a book and handing them to you to tell you exactly what he's looking
Mhm.
for or what she may want, et cetera, et cetera.
Mhm. Mhm.
So yeah, just making sure that it's very clear in what it is that we are looking for, how it is defined, and how long that may be for kid.
Mhm. Okay. Okay. So when let me fall back. How do these kids or students end up working with like a facility? Is it something that like schools input them in, or is it something that parents put them in, or hospital? You guys got like a hospital list and be like, I don't know. Yeah.
Really good question. Really good question. To receive ABA services, applied behavioral analysis services, our kiddos need at minimum a diagnosis of ASD, or autism spectrum disorder. After receiving
ASD.
that, yeah, that's going to be autism spectrum disorder.
Okay. Okay. That's the best.
Yeah,
Okay.
yeah, yeah, ASD. Once you have that diagnosis from a physician, they will refer you out to different providers. And getting that diagnosis, at the very end of it, it'll say, something to the effect of, um, I recommend for this child to get ABA services.
Hmm.
And then from there, you can go out and seek services for whatever is applicable to you and your
Hmm.
family, whether you're looking for services that come into your kid's school and work with them on a day to day in school, whether you're looking for services that are only provided in your home, or whether you're looking for services that are provided in a clinic or in a center. And where I currently work, we're in a center. We have some kids that are there from, 8 to 4, some kids who are there from 1 to 6. It's just contingent upon whatever is applicable for your child.
Hmm.
So essentially, we'll go in after getting that referral to us. We'll have parents come in, they'll tour our center, see if it's something that they are interested in, if they are liking what they do see, explain to them exactly what we're doing, what
Hmm.
a typical day looks like for a kiddo. And then from there, if they are like, yeah, I think I like this, they bring their kid back. and we do an assessment for that kid. Assessments are based on well, there are a couple different assessments that we will administer to our kids depending on their age, their skill level, the information that we've gotten from their parents, from their IEP, which is an individualized education program.
Mhm.
That is just for any kid. They may have any learning disabilities or that
Right.
needs some extra supports in the school.
Mhm. Mhm.
We review all of that prior to we have the kid come in. We do an assessment with them. We figure out what are the strengths, what are the deficits, or things that they really need to work on.
Mhm.
Things they've already mastered that they know how to do to make sure that we're not, just being redundant in the services that we provide. And then from there, we go over with the parents what we found. As a BCBA, we make a recommendation of how many hours we think that the kiddo should receive services for per week. For a kiddo who is really high functioning, as we say in the field. And really, their big thing is just working on social skills, being able to socialize with their peers or, hold conversations, focus in conversations. Those things, we may recommend something less, like maybe 10, 15 hours per week.
Mhm.
But for a
Mhm.
kiddo who's like a very early learner, which I am specifically, my career thus far has been specifically focused in what we call early intervention, or for
Mhm.
our very young learners from the ages of 2, as the earliest that you can get a diagnosis is 18 months, up to 10 years old. Is currently what my clinic services, at 2 to 10 years old. Um, but yeah, from there, we just really recommend however many hours we feel would be most effective for your kid to make the progress that we feel that they need over this X amount of period. And that is going to
Mhm.
be contingent upon their insurance, whether this is over like a 6-month period or over a 1 year period. We recommend goals that we think would be effective for your kid based on, like we
Mhm.
said, the deficits that we saw in the assessments, as well as whatever the parents are wanting.
Mhm.
So obviously in our assessments, they're, somewhere in between, an hour to 3 hours at like max that we'll have an assessment. So whatever we don't get in the assessment there, we're basing off of what we call a parent interview, which we do prior to like the actual skills assessment, where we're talking to the parent, what are the concerns that you have? What are the things that you're seeing at home? What are the things that are reported in school? What are the things that are reported or that you see out in the community? And making sure that we're able to work on those things. So, for example, the parent may say, we really want to work on the kid being able to wash their hands independently. So that was something that we will break down into simple steps, something that we may call a task analysis. And so when you think of washing your hands, it's like, okay, I'm just going to the bathroom and washing my hands. But for our kiddos, we will break that down into different steps. So,
Mhm.
the first thing that you're going to do is turn on the water. From there, you're going to rinse your hands or get your hands wet, then grab soap, then scrub your hands front, then scrub the back of your hands, rinse your hands again, turn the water off, and you got a paper towel, throw it away, breaking that down to each of those small steps. From there, we can clearly see over a period of time, we can clearly see what you are really struggling with, and
Mhm.
then tailor our programming from there.
Okay.
Um, and that's one of the cool things about it for sure.
Okay, definitely. That's cool. Do you think with your experience, are the are these practices widely accepted by parents with autistic children? Wait, okay, before you answer that, so I can confirm, is it only autistic children or is it still a wider range of other disabilities?
That's a good question. So to receive ABA services, you definitely do need to have a diagnosis of autism spectrum disorder. So you need to
Okay.
be, yeah, have that diagnosis.
Okay.
But we do work with kids who have what we call co-diagnoses. So, for example, it may be autism spectrum disorder along with intellectual disabilities, or maybe um, ADHD, ADD, attention deficit disorder, attention hyper deficit disorder, so on and so forth, just whatever intellectual disabilities that may be combined. From there, you also have to make sure that you're staying in what we call a scope of competence. And that
Okay.
is essentially that you're only accepting a client that you are prepared to work with, that you have that competence to be able to work with. That's one of the largest things there. Fortunately, at my company that I work at, Behavioral Innovation, is a very large company. They've been around for over 25 years. So there are a lot of different, what we call community of practices, where there's just really always someone that you can
Mm,
contact, that you can talk to, have extra meetings with, that has the information that you're looking for.
mm. Okay.
Being such a large company, it's always somebody that you can talk to.
Right.
That's one larger thing that you are making sure that you are staying within your competence. If your focus is only on, you know, older kiddos, only working on these social skills, then I mean, it's kind of where you need to stay unless you've done the research to stay behind it. You've gotten the CEUs. You become competent in whatever other area, or you have a competent supervisor who is overseeing you.
CEU.
I'm sorry,
CEU.
CEU is a continuing education unit. Essentially, in our field, you have to
Stay up to date.
yeah,
Yeah.
you have to maintain these skills. They want to make sure that you're still competent in the field. So right now, to maintain your certification, I think it's every 2 years, you need at least 32 continuing education units. And they can be in a wide range of things. But like I said, any BCBA or, yeah, in the field can really have a hyper focused thing that they are
Mm,
working on, whether it is like early intervention or social skills or working with older kids or whatever that may be.
okay.
For
Okay. So, even back to that original question, do you feel like this from your experience? Because I think because the field is so wide, you can't just make a generalization about it. But from your
yeah,
experience, are like parents hands on with this? Like, are they up for it? And do you guys get like pushback and how you guys are either treating or how you guys are like treating this their children, or if they're even at home continuing these kind of like this is what you learn. We're at the facility, but when you get home, you have to continue working on these things. Like, how does that kind of parent relationship
yeah,
interaction look like? Yeah,
that is a very good question. I can't speak for all clinics or all places who do
of
provide the
course.
ABA services, but I could say currently where I am. Um, One of the stipulations of receiving services is that parents are required to have what we call parent training.
Okay.
So in that original treatment plan that we make for the kids after we do the assessment, in addition to the recommended hours that we have and the recommended goals that we'll have for this kid to work on, we also have goals for the parent.
Okay.
And those goals are really just contingent upon where the parent is, where their kid is, have they, received services before? Are they new to ABA? So it may be something as simple as, starting off as what is ABA?
Mm,
What is the importance of using an evidence-based practice as opposed to um, non-evidence-based practice, or um how learning the differences between the ways that we teach. For example, we have the main two ways that we really teach is what we call DTT, or discrete trial teaching, and NET, which is natural environment teaching. And the biggest difference there is that in natural environment teaching is really something that you'll do in any given point on any day-to-day basis. So you're going outside and you're talking about the different things that you see. So for example, I see a stop sign and we're talking about what that stop sign means. This is as we're walking down the street, something that we see. This is going to be something that's in your natural environment. That's a way of teaching. Kids are continuously learning, like just in any point of the day, they are continuously learning, whether they are learning some positive things or whether they're learning some negative things, they are learning regardless.
right, right, right.
And then the other side of that would be what we call DTT, or discrete trial teaching, where it's more similar to a school related environment. It's very structured. We're sitting down at a table and we're working with whatever materials may be here. We have these
Mm,
specific goals. But the biggest thing there is that it is in a structured environment. These opportunities are contrived here, be it at a table or be it, working with other peers, that is really, yeah, contrived.
okay,
So
okay.
like I was saying, a large thing is that our parents do have to agree to this parent training aspect. um, so that we can make sure that we are consistent. Because what we're doing at home, we want, or what we're doing in center or wherever else we're providing the
Right,
services, these services, we want you to be able to do as well in home. So we remain
right,
consistent.
right,
Um, it's not going to be, any progress, or it's going to be very slow progress if we're doing something here, but wherever else you are doing something completely different or kind of on and off with it, it's going to be hard for that kiddo to, um, really
grasp it,
understand,
yeah,
yeah, really understand these concepts and understand these contingencies that are in place. Similarly, like, if a kid is with their mom and their mom is like, yeah, you don't have a bedtime, but then their dad is like, yeah, okay, no, your bedtime is 9 o'clock. It's
yeah,
like, okay, there's going to be pushback going back and forth,
right,
as opposed
right,
to if both parents are like, your bedtime is 9 o'clock. So
right,
this is what we're doing. The kid already knows, okay, at 9 o'clock, we're going to bed. Just a really
okay,
simple thing. Yeah.
mm,
But yeah, ABA has like a long history. A lot of the history isn't, the most positive, but I feel like that's one of the big things about science. Science grows, as you learn, as we have experience, as different things happen, science grows.
mm,
ABA did have like a relatively rough startup, and it's relatively a new science in comparison to really any of
mhm,
the other sciences, be it psychology, be it biology or chemistry. Applied behavioral analysis is a very new science, and
yeah,
so
because it's low-key a combination of a lot of a lot of different sciences when I actually think about it, which I think a lot of science really is. Science is really a combination
yeah,
of a whole bunch of different sciences, and then you just take whatever you want to take from it.
yeah.
Okay, I have another question. So what are like some common you can answer it either way you want to answer it. I'm actually two questions, but kind of the same question. What are
Okay.
some misconceptions about autism or autistic kids that you either had or or that you see that people have now, especially from inside the industry or inside
Yeah.
the field?
Um,
Maybe you
I feel
wouldn't
like,
have no misconception before because you had a family member.
yeah, and I wouldn't even say that. Like, of course, I still have
Okay.
misconceptions because I feel that's another thing. So understanding that everything is not cookie cutter, it's not
Yeah.
one size fits all. Autism does not present the same way in everyone
Okay.
who is on the spectrum.
Right.
Autism in itself is a spectrum, so it's gonna look completely different. It may just look like someone is socially awkward. It may look like someone has no social skills, and something that maybe if you didn't know, you may see like, oh, that person is just shy, or you may think, oh, that person is rude or
Mm-hmm.
standoffish or whatever the fact may be. But maybe that person just simply does not have the social skills
Mm-hmm.
to engage with you in the way that you expect for
On
a,
a scientific level.
yeah,
Like on the actual okay.
yeah. They just genuinely
Mm,
do not have those skills. They have not learned them. The way that they process information, the way that they process language, is not what is considered to be neurotypical or to be like the norm. And I feel like that was one of the big things coming into the field. Really learning, something that may work for this kid may not work for the next kid.
right.
Um, there are every living thing has behavior. And from there, we need to figure out why a behavior is being exhibited. And that is what we call the function of a behavior. There are four functions of behavior, and that's going to be a tangible, or you want access to a physical something, be it like a cookie, be it a game, etc. It's going to be sensory, or what we call automatically reinforced. So, for example, if you've ever seen someone that's on the spectrum that like stems, or like, will rock, or like just stare at their hand or do something like that, that's just something that's internal for them, that is reinforcing, or that is giving them some type of pleasure, that is, keeping
Yeah.
them,
Okay.
to do it again. That is,
Yeah.
allowing them to do it again. That's one of the big things there. It's sensory driven. It may be for attention. Um, I want attention from this person, so I'm going to engage in this behavior, or it may be for escape. Um, I don't want to do this anymore, so I'm going to engage in this behavior.
Mhm.
I don't want to do my work at school, so I'm going to swipe everything off the table.
Yeah.
I don't know how to read or I don't know how to answer these questions that my teacher is giving me, so I am going to just make jokes. Different things to that effect. Like I said, it's really just spectrum. It may present very differently for everyone,
Mhm.
and understanding that there's a reason for every behavior.
Mhm.
You may hear one of the big things we heard, especially growing up, is they did it for no reason, or
Right.
um, I don't know why type of thing. But at the end of the day, if a behavior is being exhibited, there is a reason. You're paying your bills because you want to live there, or
Right.
because you need whatever service that it is. There's always a function of a behavior. And that was one of the big things, like really learning that and understanding that um, it does not look the same for everyone.
Right. So how okay. 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 This is a science based off of behaviors.
Yes, solely based off of behaviors. Why it's being exhibited, how it's being exhibited, and exactly what that exhibition looks like.
So you may be able to uh, who are the doctors? What kind of doctor diagnoses autism or disability? Can
Yeah.
any doctor do that, or is that like a psychiatrist or
Yeah. So most commonly, it's a psychiatrist, or someone who does have a background in behavior or some type of psychology.
okay.
I've seen it on quite a different, quite a lot of different capacities, but if I were to go get a diagnosis for one of my loved ones, I would want it to be from a psychiatrist
Right.
that does specialize in,
Right.
behavior,
Specifically.
human behavior, or
Okay.
child behavior for sure.
Okay. Because what's going through my mind right now is that you were speaking about how you may have a client. You guys call them clients?
Yeah, clients,
Okay.
kids. I mean, yeah. I mean,
Okay.
on a clinical aspect, or like on a,
Right.
scientific
Yeah.
aspect, yeah, your client.
Yeah.
Yeah.
y- As young as 18 months. So
Yeah.
I'm trying to think of what what it's essentially would a baby be doing or not doing for someone to say, "Let me take this baby to see a psychiatrist."
That is a really good question. So there are developmental milestones. So things that you should be doing by a certain age.
Okay.
By a certain age, you should be able to hold your
Sit
head
up.
up. You
Okay,
should,
okay, okay,
be able
okay.
to sit up. You should be able to maintain eye contact. You should be able to converse with the peer. You should be able to hold a conversation.
Mhm.
You should be able to be in the same area as a peer, or someone of your same age or age mate. You should be able to be in that same area with them, without it being aversive, or without it being like, oh, I don't want to be around them, or
Right.
I don't want
Okay.
anyone around me. Being able to
Okay.
play with peers,
Okay.
different things like that. What we do is we really look for, like I was saying, some of those deficits in some of those kids when you are doing that initial assessment type of thing. It
Mhm.
may be deficits in like nonverbal communication, social interaction, like I was saying. It may be an abnormal social approach, or, like I said, you can't hold a normal back and forth conversation.
Mhm.
You may not share your interest, or display emotions as
Mhm.
you would expect. So, for example, if a kid like fell off of something and bumped his head, and you're like, I know that hurt, but that kid doesn't
Yeah.
show any,
Yeah.
reaction to it, like that
Yeah.
type of thing. Yeah. So
That's
we looking
very
for like
interesting. Okay. Because I'm thinking now, and again, I don't know if this is a good way of thinking about it or a bad way of thinking about it, but I think this goes into like a lot of misconceptions, especially with like the generation above us and older when it
yeah,
comes down to like taking kids to the doctor, and disabilities is kind of looked down on and looked as a negative thing. So like
absolutely.
I'm thinking about all the people that I knew growing up, where it's like I don't know if I can say that.
They very well might be, and they may be on the
Yeah,
spectrum. Yeah,
yeah, like
yeah. Um,
especially when you talk about again, I don't know. I'm assuming again there has to be more like processing and things like that. But like definitely just even that like that last example, like you just smacked your head and that definitely should hurt and you don't feel no pain.
Yeah. It's I feel like
I
there's
don't know.
definitely a stigma in
Mm,
a lot of different communities that I would argue for sure, like definitely in like the Black community, there's a stigma
mm,
around it. It's looked at if there is something wrong if you
mm,
are not what is viewed as neurotypical or normal or
right,
socially normal. I'm
right.
sorry, got my dog right here. Do squeak toys, but yeah,
Follow.
there's stigma around it.
Yeah.
And there should not be. Um, the way that I look at it and many people in the field look at it is like simply like, if your child or whoever else, your loved one, does not have the skills to be a functioning member of society, let's go ahead and get them the help that they need to be a
Yeah.
functioning member of
Mm,
society.
mm,
Similarly to like if you're a child, I don't know if your child can't walk, like if you were there just disabled in the capacity like they didn't have legs or for whatever other reason they couldn't, appropriately walk. You're going to get them the help that they need, be it, them being in a wheelchair, getting physical therapy to help them walk or whatever else. I would say it's the same thing with, or very similar with behavioral analysis. I mean, you're going in and we see that they don't have these behaviors to be a functioning member of society or to, function in school as they need to. So let's go ahead and get those things, going for them so
mm.
that they can be that functioning member of society. Yeah.
Okay. I'm definitely gonna if you're allowed to, I definitely would need to have like a story time of like a situation where you reconsidered where you almost reconsider is like, okay, this may not be it for me. But then I want you to follow up with a story that's like, okay, this happened and I love this job. I want to invest more. I want to invest more time into this. I want to continue going to school for this because you do have your master's. Um, I want to move up in this. I do want to attain my BCBA. So like those two
Yeah.
reflective stories.
Like I said, do the HIPAA. I can't like go deep into it as
You
far.
can't go
Well, I
deep
can't
into it,
like
of
give
course.
any like very specifics,
Yeah,
but
yeah.
when we talk about behaviors, I feel like you see some of everything working with different
Mm,
clients. I've worked in schools. I've worked in clinics. I've worked in home services as well. And so I have seen a lot since, 2021,
mm,
and working in this field, I've seen a lot. There are different things from kids who will aggress, who will flat out hit you, who will throw something at you, who will, you know, like I was talking about the different functions of behavior.
mm,
If a kid always learn, if I have an accident, that's going to give me attention. Like my parents or whoever else is going to come to me to clean me or whatever else. It may not be necessarily they're looking to be cleaned or whatnot, or that they're
right.
looking for that going to the bathroom to do whatever, but it's more so the attention that I'm getting
Mm,
behind it. So I've definitely had kids who, and this is actually during COVID, who would spit on you, who
mm,
would pull their pants down and pee or defecate in the
yeah.
room,
Mm,
and want to like play in it and put it on you, et cetera, et cetera. So it's things like
mm,
that really I feel like are like some of the most trying of days for
yeah,
sure. Where you just,
yeah,
have to be a very patient person, I can
for
say. To be in the
sure.
field, you definitely have to be a very
For
patient person.
sure. For sure.
So that's like I would say some of the bigger ones would be for
Mm,
me personally. I feel like the feces and the vomit. That's one of the larger ones for me. That's like it's
yeah.
really like it's just really like a
Yeah.
jumping on your last one. Like I need
Yeah.
a break, and that's something
Yeah.
as well to be able to say like, hey, I need a break. I need
Right.
to regather myself before I come
Right.
back in.
Yeah,
Which
because
I don't.
you have to be though. Yeah, I don't think you can, especially. I think working with kids, regardless, but like even working in general, like you have to be able to reset to continue to do whatever you're doing efficiently.
Yeah.
With the right care and time and patience and
Yes.
attention. Yeah. So okay.
Yes.
Okay.
For sure. So I feel like those are some of like the ones that it's like, wow, this is like a very
Mm-hmm.
trying position, or it's like a really
Mm-hmm.
rough day, or it's like you have so much going on. Okay, I need to get this treatment plan in. I just had an assessment and I need to finish scoring this assessment. All this is due on Friday, but I was in sessions with my therapist, teaching them and training them, assisting them with whatever behaviors may have been going on. So I didn't get to do a lot of that I need to do. So maybe it's like I'm doing a little bit extra at home, or um, maybe the next day I don't get to do as much supervision with my
Mm,
therapist because I need to make sure I get this thing done. So something like that, I would say it can be like very trying. But on the positive side, like I said, like towards the very beginning of the interview, I feel like the field is just like extremely rewarding. I remember one of my first centers that I was working at coming to Virginia. It was called Sparks ABA. And I had a client, he was 3 years old. He was nonverbal. So he didn't speak verbally. We were using different picture icons or PECs, picture exchange communication systems with him. So he would pick up an icon and, give it to you to say, I want a snack, I want a drink, or whatever else. He's picking that up. And giving them to you. But I would say it was like extremely, extremely rewarding to see him like, greet his mom for the first time during
mhm.
pickup. He's like, hey, and it's like, what? What did he
Yeah,
just say? And it's like, throwing like a whole party, like, yo, he
yeah,
just said hey for the first
yeah.
time. Or like, having a kid who's much older. If you have a kid who's 6, 7, 8, they're not potty trained, but we've been working on this thing. We've been working on him going to the bathroom. That transition to the bathroom itself may be like really rough, but okay, we finally got through that. We finally got him to be able to sit on the toilet. We finally got him to be able to void on the toilet. And when he does that void, it's like, man, this is exactly what we've been waiting for, And it's like throwing like just a real party for them. Like, dude, this
Mhm,
is extremely rewarding. And aside
mhm,
from that, like really just seeing like the progress and like the families when they're like, so like I said, we have parent
mm.
trainings, and we review the progress that you've had, that the kiddos have had, not only in school, but in home, in the community. And like parents are saying like, yeah, I remember they weren't doing this at this point, but now they really are. Or I have a kid now and she's think around 12, 10, 10, 12, somewhere around there. And like, she was like really super shy. She like really never really talked to anybody. She was like more so like reclusive. Like I'm just gonna be over here by myself. But her mom showed us a video of her like going up on stage for a talent show and
Oh,
like
wow.
going up speaking. And of course she was like, like rocking a little bit, but nonetheless, like she
Yeah,
was up there. She was
right.
talking, she was doing her thing. And like seeing that was like just extremely rewarding, bro. It was just
Yeah,
like,
for sure.
wow, like this is like, the work that we all put in and it's really
Yeah,
paying off. Like,
yeah,
yeah, like so that's like
that's good.
extremely rewarding. That's what I would say really keeps me in the field. Seeing that progress on our kiddos. Like I said, we have these goals that we set, and in any of our supervision, we're reviewing what their progress looks like. Is it like something that's like up and down and they're getting like 100% and 0% or whatever it may be? Or is it like something where it's like you can constantly see like the growth there?
Mhm,
Okay, maybe I need to change these things here. Maybe I need to change how we're teaching it. Maybe I need to change how we're reinforcing the kid or whatever else. But like, I feel like that's like, it can be extremely rewarding. And that's what's definitely keeping me in the field for sure.
mhm. That's what's up, that's what's up. How
Yeah.
do you, mm, dang, I just lost my train of thought. Ah! I had a question for you. I had a question for you, there we go. What did you get your master's in?
My master's is in applied behavioral analysis.
Okay.
Yeah, in applied behavioral analysis. I finished it in like October of this past year.
Mhm,
And I was in what my company calls an apprentice program. So it's
mhm.
essentially this program where you are coming in and you're assisting with a lot of the things that a BCBA would do. Um, the process is like fairly tedious. So to become a BCBA, you need 2,000 hours, 2,000 practicum hours, to actually be able to sit down for the exam.
Okay.
And of those 2,000 hours, only 800 or so can be directly working with the client. The other 1,200 have to be what is considered indirect hours, or um, basically doing things that a BCBA would do, be it like, working on treatment plans, be it working on behavior intervention plans, be it training.
1,200 hours.
Yeah, and that's 1,200, and that's, like, outside of the direct service, so, like,
Yeah,
yeah, finishing with all of that was, like, very tedious, but, yeah, like, with my apprentice program that I was in with this company, I only needed, like, 200 or 300 hours or so by the time I came in,
okay.
um, And so really just working on all of those different things, but they also gave you, 2 hours a day to study and then 4 hours a week or an hour, I think, a day to study, an hour or 2 hours a day to study, something like that. And then 4 hours within a week for you to take your actual mock exams.
Mhm.
So the BCBA exam, you do have 4 hours to take it. It's 180 questions, 185 questions. Um, it was a very, very difficult test, I can't say. It took a lot of like blood, sweat, and tears to sit down and, make sure you're
Mm,
studying for it, getting the information that you need. I had some really great BCBAs and supervisors in my corner who
mhm,
were able to, help me with that studying process. But yeah, that was like, very tedious, but making it through that,
mhm,
really staying dedicated is like
mhm.
really big. Like, you know what you're looking
Yeah.
for, the outcome that you're looking for, the change that you're going to make. So yeah. Yeah.
Okay. So for anybody who is like interested in becoming a BCBA or working with children with autism or disabilities, what advice would you have for them, that they can really take and do something with?
Yeah. I would say, like I said, you definitely have to have a strong sense of patience, a strong sense of understanding, and being flexible. I feel like the field is very dynamic. It's like ever
Mhm,
changing, be it with clients canceling or not being able to make it, and um, therapists canceling and not being able to make it, and maybe having to fill in for some hours or work some hours that you weren't expecting, deal with some behaviors that you weren't expecting to deal with.
mhm,
Um, yeah, I feel like you definitely have to be very flexible. That I would say that's one of the big things, being very
mhm,
flexible as well. But really, I feel like as you go out there, take some time and talk to someone who's in the field about some of the things that they have experienced. Um, Understand it's not an easy job by any means, not only in the
mhm,
BCPA position, but in the RBT as a therapist working directly with the clients day to day. It is not an easy job. I feel like it
mhm.
takes a lot. Like,
Yeah.
you go home tired, like, you're playing with kids, but you're also teaching them all day. So sometimes you're running
Mhm,
back and forth with like some older kiddos who want to play tag, who want to play like Shark and Monster, like a bunch of different, like, just
yeah.
little stuff like that. Like, um, it is a high energy field. It can be very taxing, but like I said, it's really just extremely rewarding at the end of the
Mhm.
day. When you
That's
see that
good.
progress behind your clients. And the progress that you're making with families, how the families are just really appreciative, how they're like, wow, I really see this change in my child. I really see this change in my loved one. And, it's made so much difference. Hey, we can go out into the field or we can go out into the community and do some things that I didn't think we would ever be able to do. So for example, like one of my current clients, his mom, like, would never want to take him out into the grocery store because feel like he would be too loud. He may throw a tantrum or, he may run off, things like that. But now she's like, it's for everyone. And she was like, hey, I went to the store with him and I'm able to go into the store with him and actually shop. This is like one of the first time in I don't
Mhm,
know how long I was able to actually get everything on my grocery list and not just have to like break it in the middle of it and like go home,
mhm,
take him
mhm.
home. It's like, yeah,
Okay, that's good.
keeping a why, knowing why you're doing it, having a why for why you're doing
Mhm,
it, is big as well. I mean, like the pay can be good and flexible, depending upon where
mhm,
you are and what company you're at. But um, yeah, having like a strong why, the reason that you're doing it, and keeping that at the forefront, I feel like will be
mhm.
one of the big things for sure.
Okay, that's good. That's good. So, of course, I'm gonna need some. I've known you for almost 10 years. I want to say maybe it's at nine now.
Yes. Yeah, sounds like
And we
yeah,
we we've been talking about you're already kind of known. I've had this vision back in college, and we talk about it, and you see my plans, my drafts, everything, everything, everything.
for
So,
sure, for sure.
what is some advice that you have for me?
Ah, ha, ha, ha,
Yeah, of
crazy.
course, I love advice. So especially from people who know me, who've like been able to like track my growth and see my growth in a natural, genuine way. Um, those are
Man,
I like to hear what those people have to say as well, of course.
yeah. First thing first, what you always do is keep God at the head of your life.
Mm,
Always look to God for whatever questions that you got, whatever answers that you're needing, whatever struggles you're going through. Looking to God for the answers there. Um, and I feel like what you're doing is like really amazing. Like you're really exposing a lot of people to a lot of the different things that are available. Like you were saying,
mhm,
like even going into college or before you have that process of if you do want to go to college, it's like, you
mhm,
think you may know what you want to do, but life will show you, you know. Um, Whatever you may have had as your original plan may not go that way, but staying focused. And I feel like that's really big. I love what you do in this paid and
mhm.
passion, like
Appreciate it.
continuing to like, yeah, show our
For
community
sure.
like the different things that are available for them.
For sure.
Um, yeah, I would say just really like
Yeah.
really keep doing this. Like this is
No,
really
for
cool.
sure.
Like,
For
yeah, like
sure.
this
I appreciate that.
exposing us to different things that are available.
Yeah.
And um yeah, and I feel like you are continuing to broaden your circle, broaden like the people that you are interviewing and whatnot. I just had like your
Mhm,
first interview outside of America, and that was really
mhm.
cool to see as well.
Right,
So
right,
like
right,
yeah,
right,
yeah,
right.
yeah.
I appreciate that.
Man, I would say definitely
That's
just keep going the way you are, bro. Like
yeah.
I feel like this is something that's really big. I feel like this is something that's really
Yeah.
important,
Yeah.
something that is,
Yeah.
yeah, something that's really important for sure.
Yeah.
So I would say,
I have some things cooking up, so I'm trying to make this life changing for
yeah,
myself also, of course. So yeah, now I definitely got some things cooking up, and we're just gonna continue to see how everything goes, how God directs me in all these steps. And,
absolutely. Follow me.
ultimately, it's like putting the right people in front of me to give me the opportunity to, have these conversations. So,
Yeah,
no, yeah, I'm definitely working on some big things coming up.
yeah, and
So,
like broadening your horizons as well, like how you're doing with like the different gear and whatnot, the merch. Actually,
mhm.
hold on. This is what I should have had on from the jungle. Where's my pin? This is the jump. Like y'all done seen like the new stuff, the jerseys and whatnot.
Yeah,
What y'all know about like
that's what
the
I'm saying.
old
The
paper fashion?
hoodies,
Yeah,
like
like yes. Like this is yeah, stuff like this, like to
yeah.
continue broadening your brand. Like I'll be seeing
Mhm,
like your different stuff that's being posted like out there in Texas, like different folks having on their paid and fashion jerseys and I'm like,
mhm.
yes, sir, this
Yeah,
is beautiful to see. This is beautiful to
yeah.
see.
I am my goal is to make it a household name
Yeah.
to where like I just have different collectibles that people would just have paid in passion things. Like, I already got like the stickers on the phones and stuff, but like
Yeah.
posters and wall art and anything that's inside your house, you'll be like, okay, I want it to be a household name for real. So that's really
Yeah.
what I'm working on.
And I feel like you got a
Uh
good, like, really background behind it is like, letting your passion work for you. What is it that you're passionate about? And then
mm,
from there, letting that pay you. So, like, yeah, I feel
right.
like that's very important. Like, whatever you're doing in life, I feel like it's going to suck. You're going to feel like stuff sucks if you're just doing something
Mm,
for a check or you're just
right.
doing it for like non-reinforcing reason. But like for you to do
Mm,
something that you're actually passionate about, it makes like those rough days worth it. It makes
right.
those times where it's like stuff done got hard. It makes it
Mm,
worth it for sure. So like,
right.
yeah, I really love that for
Right,
sure. For sure.
definitely. And I even think with stuff like this, it's not necessarily you could be passionate about a lot of different things. So I would like to put that out there as far as like because I can understand the viewpoint of you're passionate about something, but if you try to make it your job, it could ruin that as your passion. And I'm not necessarily wanting people to pursue their passions to be their job or main income, but I definitely want to differentiate a hobby from a passion. It could be people bowl for fun,
Yeah.
but then you have people who compete to bowl. And again, it's not their main job or nothing, but this is just something that they just so passionate about that
Yeah.
it's making them some money on. And
Yeah.
if you can, why not? So that's
Yeah.
definitely something that I want to pinpoint.
Yeah.
But
I feel like that's
I
one of my
got,
big things too. Like for me, is
mhm,
playing the game and whatnot, being on the
mhm,
game. Like that's something that I'm passionate about. No, I'm not streaming, but it's something that I do and I enjoy it.
Yeah.
Like that's,
Yeah.
makes my days a little bit easier. Like that's
Right.
like a stress relief. So like,
Right.
yeah, being able to maintain the things that you are
Mhm.
passionate about with them and stay
Right.
tapped in with it for
Yeah.
sure.
And just identifying what could be profitable or what could what you could pursue as an actual job, and that you wouldn't be burnt out. Well, burnout is different. That's a whole different thing. But something that you would still, even when you are on your last string, that you would still love doing that versus another passion where it's like, I want this strictly to be my passion. I don't want this to cross over into my work life. But however, this is something that I am passionate about, and this is why I'm passionate about it. And those are also people that I would definitely. mm, People do things for free all the time, and they're doing great
Yeah.
work.
Yeah.
They're doing great work, fundraising and events and so much different things that they just do for free because they are passionate about it and they'd rather not get paid from it. So, you know. So of course,
Absolutely.
I got one last question for you, man.
I
I got
heard it.
one more
Heard it.
question,
Okay.
man.
Okay. Okay.
Uh,
Okay.
could you tell me why tell me why is human nature? I'm just playing. That's not the question. That's not the question. That's not the question. That's
Why
not the question. That's
does
not the
this thing?
question.
What?
What is something that you own but everybody else uses?
Something that I own that everybody else uses. Hmm. Something that I own that everybody else uses. That's a good question. Um. Wow. I don't even know.
Oh, your name.
Oh, for
Oh,
sure.
your name's right there.
For
Okay.
sure.
Well,
Yeah, I will argue
you own
that.
your
I will
name.
argue
Yeah,
that. For
you own
sure.
your
For
name,
sure.
but everybody else use it.
Yeah,
But yeah,
absolutely.
man, I
Absolutely.
I appreciate you for being on here, man. You already know, man. It's all love. We're gonna continue to chop it up.
Absolutely. Absolutely.
There'll probably
Absolutely.
be some people, like I already told you before the episode, there's some people that's interested in BCBA. So, I love to bring this network together. Y'all see that?
Contact me.
Contact him.
Yeah.
And if y'all need to contact him, let me know so I can let y'all know to contact him. Blah, 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 blah. But again, thank you guys for tuning in to Paid in Passion.
Thanks
Let
for
your
having me.
passion work for you.
Yes,
All
sir.
right, man. Yes, sir.